I'm a patient coordinator for Better Hair Transplant Clinics, and I work closely with each patient before and after surgery, making sure they're well informed before they sit in the seat with the surgeon, and well informed when they come out the seat, and days after, weeks after, months after, keeping up with the progress and making sure they're happy with the results as well. I'm really nervous at first because obviously it's a big decision to have surgery, and they don't know what to expect, so they're always thinking it's going to be quite painful, but the day after when I speak to them they always say, oh, it wasn't as bad as I thought. The only thing is they have to wait for the hair, so they're not going to just walk out of surgery and have a full head of hair. It's going to have to wait for the hair to grow through. So it's giving them the expectations of not to rush and be on the phone worrying at 6 months stage that they're not getting any hair growth, because it will be patchy. Up until 12 to 14 months later, that's when we say they'll have the full result, and that's when we give the patient a full review. If they're too young, obviously we would recommend alternative methods, and we'll discuss that with them about losing and their family history, because that's important. So it's not just about, yeah, you need a hair transplant, we'll get you in, take your money. It's about educating them that they are going to lose the hair further, and the methods that they can use to stop that progression, as long as they're doing the hair transplant as well as the other treatments. They should get a fantastic result. Otherwise, in a few years' time, they're going to lose more hair and then have to come back and have further surgery. So yeah, anxiety-wise, I think beforehand they are really anxious because they just don't know what to expect. I think it affects them. I mean, we always ask them on a scale of 1 to 10 how it affects them. Most of them are in the 8s and 9s. It can stop people going out socially. They don't, they feel depressed. So it does affect their mental health. Because of the society we live in today, it's all about how you look, and people just don't want to lose the hair and look 10 years older. If they can have surgery and look better, feel better, then it gives them confidence. Yeah, I do think it is. Yeah, social media and everything else is quite negative, and it is about how they look. And you see the likes of Love Island, and they've got perfect bodies and perfect hair, and that's just the way of the world. But I think, like you said before, it's just embracing and being confident in yourself. Mm-hmm. But not everybody has that. Mm-hmm. And they have to go and search for that elsewhere. And we do have to say no to some people. If they've had 3 transplants, 4 transplants, they might have the donor area might not be sufficient, but they'll still be trying to chase more hair. And what you've got to say to them is you've had enough surgery, you can't have any more. So that can be quite hard. We do have men in their 60s or 70s wanting a hair transplant, and we do have that age that they are still bothered about that. And again, that goes back to each to their own. It's just because he's older doesn't mean he's not worried about his hair loss. So we do treat men in the 60s, 70s, as long as they're fit and healthy. But that doesn't happen because it's a slow process. So their friends and family, sometimes they don't want them to know, and they wouldn't know. They'll just be thinking they're on medication or something to help the hair grow. You can disguise a hair transplant. It's not like you just wake up tomorrow and you've got a full head of hair. It takes months, so people don't necessarily notice that the colleagues had a hair transplant. Somebody like myself who's in hair transplants will notice people around that has had them because I can see, but most people wouldn't know. Definitely, if it affects them going out socially, they're not going to meet the love of their lives, and it might affect their relationship. They might not feel confident, and that's why they seek our help. When we're talking to them before, we're letting them know what to expect in surgery on the day. The do's and don'ts beforehand is important, and the aftercare afterwards. The main thing afterwards is they don't do anything strenuous for 2 weeks. So you've got to plan that around, the time off work. If they're a builder, if they're lifting heavy things, they've got to have 2 weeks rest, complete rest. So we have to make them very informed, because otherwise they're going to disrupt the hair transplant and they're not going to get the results. So aftercare is extremely important, and we provide all the medications and the sprays, the shampoos, everything to have afterwards. You don't know what is going to be next. There might be some miracle cure in the future for hair loss. There might be no transplants, because at the moment we can, some surgeons can use donor hair from the chest. There's always going to be some things, if they've not got a good donor area at the moment, we don't know what the future is going to be for them people. But what I always say is, there's what we've got now on the market, and what we don't know is, stem cell therapy is going to be big, and you just don't know what the future holds. So I always tell people to cross that bridge when they come to it, because they might have a hair transplant today, and then in a few years' time there might be something else on the market that overtakes us. There is things out there that they can do to stop the hair loss, from a young age: finasteride, Propecia, Regain, PRP therapy. So there's all those alternative methods first that people can use to stop the hair loss. But then, it goes back to the fact of, if they're young and they're seeing all this in the papers and on social media about having hair transplants, and all the celebs and footballers are having them, then they're probably going to get that as a negative thing, that baldness is not a good thing to have.